Now, authorities in Baringo have expressed fears of a hepatitis B virus outbreak in the lower lands of the county.
The County Director of Medical Services says a sizable number of people have died from the disease since January.
Eunice Omollo reports that the government of Baringo has launched a diagnostic and vaccination drive, as well as a door-to-door awareness campaign.
The green leafy subduing hills and the serene landscape of the lowlands of Baringo County hide the gloom and an unpleasant story of families in Mogotio sub-county. In Majimoto village, sadness shadows this family. The members are mourning the loss of their 14-year-old son. The boy, in his blooming teenage years, succumbed to hepatitis B. The son at 7 pupil Ruben Kibet died after a long struggle with the disease that damaged his liver. The treatment at the Marigat sub-county hospital was too expensive for the large family, and he missed continuous treatment that cost them 4,000 Kenya shillings per week. To make matters worse, his sisters and mother, who dedicated their time to nurse the boy before his death, also got infected.
Kwa hivyo waliweza kupimwa na kisha wakapewa dawa ambayo wanaendelea kutumia hata sasa hivi.
Hepatitis B is contracted through exposure to infected blood and various bodily fluids, including through sexual intercourse. Transmission of the virus may also occur through the reuse of needles and syringes, either in healthcare settings or among persons who inject drugs. It can cause chronic infection and puts people at high risk of death from cirrhosis and liver cancer. Young Kibet is just a personification of rising numbers of people who die after ailing from the disease that attacks the liver. In Baringo South, 12 people have succumbed to the disease since the beginning of this year.
In this area, we have had 2 cases who have died of hepatitis B, and the deaths is majorly because of the complications.
Almost all the villages, 8 villages, people were found with the infection, and I suspect there are still some more who have contracted the disease, of which we may not know the cause.
The county officials have put the percentage of those affected to up to 10% of the population. The high rate of infection has been attributed to lack of knowledge on the disease symptoms, hence delayed diagnosis and treatment.
Prevalence in the county is around 10%. That means when we go to the total population, that means close to around 70,000 people have hepatitis B.
Hepatitis B vaccination has a 95% chance of prevention against the killer disease.
We have enough drugs for vaccination. We are still going to order more if need be, because from there we shall ensure that this disease is eradicated once and for all, especially for those of us from the age 16 and above, because I've been given to understand those of them that are age 15 and below have been given the vaccination while they were young.
Eunice Omollo, NTV.